Hello, everyone. Welcome to episode 47 of the LUMP TCM Basics, or what we call the TCM 101. Let's start with our first presentation by Ma'am Nitz Yu, certified acupuncturist of Silang, Cavite. Good afternoon, Ma'am Nitz.
Good afternoon, Doc Hector. Good afternoon, classmates. So, topic for today is blood deficiency. Okay? Yan po yung tower diagram ng blood deficiency. Tingnan niyo pong mabuti. So, blood is fluid and nutrition. So, it is nourished by the spleen through food and drink and by the lung through breathing. So, yung kidney make bone marrow which makes blood without all this nutrition, and the heart synthesizes the red blood, putting all the different nutrients together. So, yun po yung composition ng blood. The liver stores and releases blood, and when there is blood deficiency because of any reason, for example, the blood stored by the liver is also decreased, okay? The term blood deficiency in TCM does not mean that the patient has a low hemoglobin count, okay? But iron, both in food and as a supplement, does help in the treatment, okay? So here, the symptoms and treatment. Symptoms of blood deficiency: paleness, coldness, dizziness, okay? Always tired, weakness, and poor sleep. Easily sleeping arms and legs, numbness or pins, yan. And needles improve with activity. Okay. Numbness as an aura before headache after menstruation or stress, weak muscles and tendons, poor endurance, pain with overuse, little and scanty menstrual bleeding with long cycles, depression, and anxiety. So yung treatment, mostly common are heart and liver blood deficiency. So pag merong ganyan, blood building points yung gagamitin natin. REN 14, bladder 15, spleen 10, heart 9, SI3, GB 39, okay? So eat sweet foods, grains, potato, and proteins. Use milk foods in moderation. Use thick soups, chicken soup. Use overcooked foods. So to digest easily, red, yellow, and orange colors yung kakainin din, okay? Yung pa yung mga advice. So blood deficiency can cause imbalances in yin, yang, or qi. Okay. Tingnan nyo po yung tower diagram. This is the blood deficiency. Number 1, the functional energy may decrease. Okay. Blood deficiency can cause dryness. Number 3, it may cause interior winterize. And number 4, it may cause cold. Okay? Yan po yung causes ng blood deficiency. Thank you very much for listening.
Thank you very much, Ma'am Nitz Yu. Let's now proceed to second topic. Let's call on Sir Dino Pinheiro of Legazpi. Sir Dino, good afternoon.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the pulse qualities, part 2. The level of depth. The normal pulse is felt at 2 levels of depth, the middle and the deep. So dito sa illustration, kung na-observe po ninyo yung superficial, nasa may middle and deep po yung sensation ng pulse. When pushing down from the top, the first level one feels clearly is the middle level. So ito po yung sa gitna. This shows the pulses of the young organ. So pag naramdaman po natin, this is the indication of the young organs. Having pushed down completely, lift the fingers slowly. The first moment one feels the pulses clearly is the deep level. So yung deep level na po yung sunod, this level shows the pulses of the yin organs. Okay? The superficial pulse is not normal under general circumstances unless the person is very thin. So hindi dapat natin maramdaman yung superficial pulse. under general circumstances. However, one could have a superficial pulse in two situations. So dito sa illustration, ito po yung superficial pulse. When the organ which has a middle level pulse position has excessive yang, its pulse will ascend. So yun po yung organ which has middle level pulse, tumaas, excessive yang po yun. Okay? When climatic pathogenic factor attacks the body causing an exterior symptoms, may symptoms po siya like common cold, stiff neck, aching muscles, sunburn. The superficial pulse shows that the pathogenic factor is still in the outer tissues of the body between the skin and muscles and has not entered the interior of the body. In this case, the pulse should be superficial. So ito po yung reason kung bakit nararamdaman natin na nasa ibabaw po yung pulse. Next, we go with the deep pulse. When the pulse position seems to be deeper than where it should be, then it is said to have descended. So bumaba. This could be either because there is an interior disease where a pathogenic factor has attacked the interior, or it could mean that the organ at this pulse position has a yang deficiency and has insufficient yang to ascend it. So meron siyang yang deficiency and nag-descend po yung pulse. Okay? Thank you for your attention.
Thank you very much, Sir Dino. Let's now have the third topic. We shall continue with hot and cold. Okay. Hot or cold. So now we see a patient that is feeling cold all over. So acute coldness and shivering can be from exterior climatic factors. Okay, so we have the kidney involved. If there is cold in the low back, legs, and feet. So if the patient would say, or you could feel that there is cold in the low back, legs, and feet, it's definitely kidney involvement. So if cold upper body and hands, that will be the heart. You could see the tower diagram there. And cold hands, feet, and face, it's spleen. Okay. So for exterior cold invasion, we do sedation of kidney 5, which is the she-cleft point, and Li11 for the immune system. Kidney yang deficiency, we use the Bakshu point of the kidney, bladder 23. Kidney 3 tonifies the yang on the controlling cycle, and bladder 67, tonification point. Kidney 1, moxa for warming the feet. With heart yang deficiency, we use bladder 15. Bakshu, the heart. Heart 3 tonifies yang on controlling cycle. SI3, indirect tonification over coupled yang organ. Then heart, blood, and chi deficiency. REN 14, which is the mu point of the heart. Bladder 15, heart 9, tonification point of the heart. SI3, tonification point of the small intestine. Then the influential point of the blood, which is bladder 17. And the influential point of the marrow, gallbladder 39. And we moxa pericardium 8 for cold hands. Spleen yang deficiency, of course, we use the Bakshu of the spleen, bladder 20. Then the grandmother point on the controlling cycle, spleen 1. Stomach 36 to improve the stomach yang, and the influential point for blood vessels, lung 9. For spleen, blood, and chi deficiency, we use the front mu of the spleen, which is liver 13, bladder 20, and then spleen 2, the tonification point, and the stomach 41, tonification point of the stomach. Patients may have cold feet, and sometimes they do not feel it. This would be low temperature and poor sensitivity. So that means both chi or function, and heat or yang are deficient. Although a yin deficiency state is a yang dominant state and normally produces a feeling of heat, if there is deficiency in blood, this can produce coldness too. Have we not heard patients tell us that they are cold because they have not eaten or because they have not slept enough? They feel warmer after eating or sleeping. This is coldness from blood deficiency or deficiency of nutritional energy, the yin qi. In some patients, their cold feet improve with the kidney 3, which tonifies the yang, and sometimes with kidney 7 to tonify the yin in other patients. Thank you very much for listening. Let's now call once again Sir Dino Pinheiro of Legazpi for the metal element. He will start with a new element. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go with metal element, a concept. So here, yung metal element natin, yung lung and the large intestine. So sa my left side, yung yin dominant, and sa my right side, yung yang dominant circle. So we have the metal is the great protector and the great eliminator. The lungs control the respiration and the lungs ascend and descend water. Next, yung lungs open to the nose, senses smell. Next is secrete mucus. Lung nourishes the skin and body hair. Associated emotion is grief. Next, yung flavor is spicy. Energy giving color is white. The climate is dry. And yung coupled yang organ, yung large intestine. Metal are great protector and eliminator. The lung nourishes the skin and controls its open-close function. This is a very important function in temperature adaptation to exterior climate changes. It is not only the decision to open or close that is important, but also the moment to do so. The skin should open when we are hot or after an attack by a climatic pathogenic factor. It should be able to eliminate the heat or other pathogenic factors. Thus, it opens to cool the body by sweating and letting out excess heat by opening the pores. The skin should close by the same system which when it is cold outside and we need to preserve our body heat. If the lung qi is deficient, the lung function is poor. The skin will not open and eliminate heat when we feel hot, nor will it close and keep in the heat when we are cold. As a result, we will tend to feel very uncomfortable and stuffy when hot or sweat more when feeling cold. Okay. In the case of an exogenous pathogenic factor attacking the body, this factor remains within the outer surface of the skin and muscles for up to 3 or 4 days, causing exterior symptoms such as feeling cold or hot, sweating excessively or unable to sweat, having an aversion to wind and symptoms of common cold or headache and aching muscles as during a flu. If the pathogenic factor wins this battle, the symptoms move deeper into the internal organs. If the immune system wins the battle, the patient's health returns to normal after 1 to 2 days or feeling out of sorts. Whether the skin can open and eliminate the climatic pathogenic factors depends on the lung qi or our protecting wei qi, the immune system. Cold or spontaneous sweating. To treat a person who sweats when feeling cold or sweats in areas of the body which are cooler than the others, we should tonify the functional qi of lung. Points to regulate sweating. We use UB13, which is the Bakshu point of lungs, improves function. Li11 tonification point of coupled yang organ indirect tonification of lung yang. Li6, the Lu point, sedates yin and tonifies yang. Alternating hot and cold showers or cold shower following sauna, this will train the skin to open and close quickly. Cold extremities together with sweating should be warmed with moxa, and point lung 9 could be added as an influential point of blood vessels. Acute treatment of exterior symptoms following climatic exposure. Symptoms are acute onset, feeling hot or cold on skin, or aversion to wind, excess sweating or cannot sweat, fever or chills, headache, aching muscles, common cold, excessive thirst or no thirst, tongue coating of different types, superficial pulse. So thank you po for listening.
Thank you very much, Sir Dino. We now listen to Ma'am Lynn Galarita once again as she begins a new topic. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. For today, we have a new topic, which is the 8 principal syndromes. So what is this all about? Syndrome differentiation in TCM is a method to analyze and recognize the syndrome of a disease. In other words, it is also a process in which the location, nature, occurrence, and development of a disease, as well as the condition of health of Qi and pathogenic factors, are identified according to the clinical data obtained from the 4 diagnostic methods. So from the above, it becomes obvious that syndrome differentiation is the premise and foundation of treatment. So correct differentiation and appropriate treatment are the prerequisite for achieving the hoped for results. So let's move on to what is this 8 principal syndrome. The 8 principal syndrome refers to the yang and yin, exterior and interior, cold and heat, deficiency, and excess. This is the most important syndrome in TCM. Complicated as the clinical manifestations of diseases may be, they are classified under the 8 principles. So the classification of syndromes, first we have to determine whether it is a yang or yin syndrome. Second, we look into the location of the disease, whether it's exterior or interior. Third, the nature of the disease, whether it's cold or heat. And the last, the state of health of Qi and the pathogenic factors, whether it's deficiency or excess. So let's talk about exterior and interior first. These are the 2 principles for differentiating the location and severity of diseases. If it's exterior, the surface of skin and body hair, the muscles, and the channels are affected. And it's already interior, it involves the Zangfu organs, the blood vessels, and the bone marrow. In exterior syndrome, it indicates the exterior parts of the body is affected by exogenous pathogenic factors, and the diseases is in its primary stage and relatively mild. So in analogy, if the enemy, it's compared to an enemy invading a country. So if the enemy invades our border, our army will go out for fight, and then the border will become the battlefield at this moment. So nasa mga borders, kung sa katawan natin, the exterior parts of the body is affected by exogenous pathogenic factors, and the diseases is in its primary stage and relatively mild. Exogenous pathogenic factors intrude human body through body hair and skin, muscles, and channels, or through the mouth and nose, and characterized by rapid onset and short duration. For the symptoms of exterior pattern or exterior syndrome, we have fever, superficial pulse, a white thin coating on the tongue. This is a fight between the health chi and the pathogenic factors. We also have an aversion to cold, where the hindrance of the defensive chi fails to warm the body. Exterior syndromes will also have nasal obstruction, nasal congestion, itching and pain in the throat, and cough, because the lung is impaired by the pathogenic factors. This syndrome will also present with headache as the unsmooth flow of chi and blood caused by the pathogenic factors. Next is the principle of treatment with exterior syndrome. So we relieve exterior syndrome with drugs pungent in flavor, like ginger. So this is all for today. Join us again next time for the continuation of our discussion on the 8 principal syndromes. Thank you for listening.
Thank you very much, Ma'am Lynn. Let's welcome once again Ma'am Needs You for the Counterpowering Cycle. Good afternoon po ulit, Ma'am Needs.
Good afternoon, Doc Hector. How is my audio? Kasi umuulan dito sa amin eh.
Okay.
Okay naman.
Sige, okay din po so far.
So, okay po. Topic for today is counterpowering cycle. Yes. Yan po yung diagram. Tingnan natin yung metal. Metal is deficient and then yan, yung counter niya, yung sa gallbladder. Okay. This is the explanation. So in this diagram, the lung yin is deficient and is therefore unable to send yin to the gallbladder and control its yang. As a result, gallbladder yang rises. This means controlling cycle is not functioning well. If the lung does not control the gallbladder on the controlling cycle, and if the gallbladder yang gets higher than the lung yang, then gallbladder yang will control lung yin. Gallbladder yang would flow to the lung, controlling the lung yin and increase the lung yang, okay? Because this energy flow occurs in the opposite direction to the normal flow, it is called counterpowering cycle, okay? When energy flows in the opposite way, it is called death, namatay na. The treatment must aim to restore the normal direction of energy flow, okay? Treatment, the first we will be using is the gallbladder 38 sedation. We should disperse the excess gallbladder yang and send in the normal way. Use lung 1 or the move front move, and the lung 7, which is the low point, to tonify the lung yin to reassert control of lung yin on gallbladder yang, okay? This explains why wind symptoms manifest mostly in the lungs and skin, even though internal wind is generated by the liver, okay? So here is an example of counterpowering cycle. Hepatitis with jaundice and pruritus is a good example for this counterflow. Not every patient who has hepatitis gets skin irritation. Only those patients who have lung deficiency with very dry skin will suffer these symptoms. This means if wind symptoms manifest on the lung must be quite yin deficient, okay? Energy always flows from where it is in excess to where it is deficient. If lung yin was in a strong position, it would flow to gallbladder and control its yang and indirectly also the yang of the liver, okay? So understand na lang po natin. Thank you for your attention, everyone.
Thank you very much, Ma'am Needs. Ingat po kayo dyan, umuulan na naman. Okay. Now, let's call once again Ma'am Lynn Galarita for Meridian Theory. She will continue her discussion of the gallbladder channel.
Good afternoon, everyone. So for the continuation of our discussion on the gallbladder channel, for today we'll move on to the physiological significance of the of the channel changes. So this will aid a lot in our diagnosis and formulation of treatment. One, if we observe redness or swelling in the outer canthus of the eye, we can say that there is presence of wind heat in the gallbladder channel. So as for pulse palpation, there are no special consideration for palpating pulses along the channel. In palpating the channel, pressing the points, and feeling the body surface, we often see tenderness in the area, or if we see tenderness in the area between GB41 and GB43, this often indicates gallbladder channel or organ heat. The more prevalent the nodules in the area, the more likely that dampness is also a significant factor. So here is a picture of the locations of GB39, 40, 41, 42, 43, and 44. So let's continue our palpation. Nodules or tightness in the fascia around GB40 is often indicative of gallbladder fire counterflow. The area will also be severely tender in the presence of stones in the gallbladder or an inflammation of the gallbladder organs, as in cholecystitis. Gallbladder 40 can also become puffy and slightly swollen in the presence of Shaoyang Qi deficiency or accumulation of cold in the gallbladder. Because GB40 is the source point, conditions that manifest with changes in this area are the most often rooted in deficiency. Qi constraint in the gallbladder channel often manifests as tenderness or pain at GB34. This can lead to a wide variety of problems ranging from shoulder pain, neck stiffness, and sciatica to internal conditions such as hepatitis, irritable bowel syndrome, wherein the liver overacting on the spleen is primary, or in gallstones. Shaoyang type constipation also may coincide with tenderness in this area. Okay, this is another picture again emphasizing GB40. So in summary, for gallbladder 34, if we feel tenderness on this point, we can say that there is mild Qi stagnation affecting the pathways of the Shaoyang channel. If there is pain of the more severe type, there is a more severe type Shaoyang constraint. There may also be affecting gallbladder organ. If there are nodules, this could mean chronic deficiency of the Shaoyang channel with Qi stasis. If there is swelling on GB34, this means that there is gallbladder deficiency for Shaoyang channel or Shaoyang channel deficiency, which involves cold. So in GB40, if there is tenderness, This could mean swelling and inflammation along the pathways of the gallbladder channel. If there is tightness in this point or thickness, this means gallbladder fire, counterflow. This could also involve nodules and pain. For gallbladder 41 to 43, if we palpate shallow nodules, this could mean dampness and heat affecting the Shaoyang and may involve the ministerial fire. If there is tenderness, this could mean more severe heat affecting Shaoyang channel or organs. If there is swelling on these points, this could mean cold along the path of gallbladder channel and open on the hip or the low back. So this caps our discussion on the gallbladder channel. Thank you for listening.
Thank you very much, Ma'am Lynn. Okay, we will continue now with chronic fatigue syndrome, still on the Western concept. Bayhan and Bakhait give the best description of the mode of presentation and clinical manifestations of chronic fatigue syndrome, which they attribute to an acute viral infection. Therefore, it is called post-viral fatigue syndrome. In an analysis of 1,000 patients seen over 15 years, the most common initiating factor was a viral infection, presenting with a sore throat, acute gastroenteritis, acute labyrinthitis, or myocarditis. Symptoms included headache, nausea, dizziness, severe myalgia, intense malaise, and low-grade fever. The debilitating fatigue is not relieved by bed rest and is made worse by exercise. The condition waxes and wanes, but the patient never recovers his previous healthy state. Bayhan and Bakhait consider a clinical viral infection followed by severe fatigue to be the two essential characteristics of chronic fatigue syndrome, or post-viral fatigue syndrome, as they call it. Other clinical manifestations, according to them, are myalgia, depression, sleep disturbance, irritability, poor memory and concentration, fluctuation in body weight, worse in women, intermittent low-grade fever, poor appetite, abdominal fullness and distension, alternation of constipation and loose stools, night sweating. According to the Centers for Disease Control and Prevention, or CDC, the primary symptoms are greatly lowered ability to do activities that were usual before the illness, worsening of the ME or CFS symptoms after physical or mental activity that would not have caused a problem before illness, which is known as post-exertional malaise or PEM, and sleep disorders. In addition to the previously mentioned core symptoms, one of the following two symptoms is required for diagnosis: problems with thinking and memory, worsening of symptoms while standing or sitting. The majority of these patients experience some type of pain: muscle pain and aches, joint pain, but without swelling or redness, headaches, either new or worsening. Some people may have other symptoms, including tender lymph nodes in the neck or armpits, frequently experience sore throats, digestive disorders such as irritable bowel syndrome, chills and night sweats, allergies and sensitivities to foods, odors, chemicals, or noise. As for the causes of CFS, Shepard considers the following to be the causes or risk factors: genetic factors, young age, average age at onset is 32, females are more prone, excessive physical work, and mental stress. Thank you very much for your attention, and we hope you could join us again next time. Thank you.